Imagine sending a text message and immediately wishing life had a CTRLZ button.
Oh, absolutely. We've all been there.
Right.
Hmm.
Just a quick keyboard shortcut to undo a mistake before it becomes permanent. And I mean, you've probably felt that way about a hasty email or maybe even a terrible haircut.
Yeah, the classic bad haircut regret.
Exactly. But like, what if you could apply that exact same undo concept to a permanent decision about your physical body?
Well, it completely shifts how you approach the concept of permanence.
Mm-hmm.
I mean, the idea that you could literally erase a medical or aesthetic procedure,
Mm-hmm.
if you just changed your mind or if a severe complication happened, it's basically the ultimate psychological safety net.
It really is. And so today, our mission is to explore the science behind dermal fillers and their almost magical undo button, which is an enzyme called hyaluronidase.
Right.
But we aren't just giving you a standard breakdown of lip plumping or, cheek contouring today. We're actually pointing the microscope at a fast-growing, highly intimate trend.
The very specific trend, yeah.
Yeah, labial fillers, which are often referred to as labia puffing.
Yeah.
And the core focus driving this entire deep dive is answering one crucial question. Can these intimate procedures be safely dissolved if you change your mind? Or if something goes wrong?
It is a really fascinating intersection of aesthetic trends, intimate anatomy, and biochemistry.
It's wild. And just so you know where we're getting all this, we are pulling from a really comprehensive stack of clinical guidelines, aesthetic clinic protocols like the ACE group guidelines, and some heavy-hitting medical research on the molecular behaviors of both hyaluronidase and hyaluronic acid.
Yeah, it's a lot of dense science, but it's so important to understand.
Okay, let's unpack this, because before you can really understand the canvas, the labial tissue itself, you need to understand the eraser.
Exactly. You have to start with the array.
Right. So in the sources, this enzyme, hyaluronidase, is referred to by brand names like Hyalase or Hylenex. On a purely molecular level, what is this enzyme actually doing when it enters the body?
Well, so hyaluronidase is a naturally occurring enzyme, and its primary biological job is to cleave, or basically break down, hyaluronic acid.
Which people probably know from, like, skincare serums, right?
Oh, yeah. HA is huge in skincare marketing.
Mm-hmm.
But biologically, it's a massive sugar molecule, a glycosaminoglycan.
That is a mouthful.
It really is. But it occurs naturally in your skin, your eyes, and your connective tissues. It basically acts as the mortar in your cellular scaffolding, keeping everything hydrated and structurally sound.
Okay, I'm with you.
So when you get an HA-based dermal filler, you're essentially injecting a synthetically modified, highly concentrated version of that natural sugar straight into your tissue.
Wait, okay, if it's just a natural sugar, why doesn't your body just, absorb the filler immediately? Like, why does it stay there?
That's where the synthetic modification comes in. See, native HA in your body is essentially a liquid.
Oh, really?
Yeah. So to turn it into a filler that can physically lift and shape your tissue, labs have to use chemical binding agents to cross-link the HA molecules.
Cross-link. So they're like tying them together.
Exactly. They basically tangle the sugar chains together into a really dense, viscous gel. And this cross-linking process is what stops your body's natural enzymes from breaking the filler down right away. It's how they get it to last for a year or even longer.
I see. Okay, so the filler is specifically engineered to resist your body's natural breakdown process.
Right.
But then you introduce concentrated hyaluronidase. I'm picturing this enzyme like a molecular pair of scissors just going in and snipping those synthetic crosslinks.
That is a highly accurate visual, actually. When a medical professional injects concentrated hyaluronidase into an area with HA filler, the enzyme attacks those glycosidic bonds, holding that tangled gel together.
So it's just chopping it all up?
It rapidly depolymerizes it. So instead of a thick, cohesive gel, you're suddenly left with these fragmented, simple sugar chains.
Wow.
And once it's chopped up into those simple fragments, the synthetic cross-linking is defeated. Then your body's lymphatic system can just naturally absorb and metabolize the debris.
But there is a massive caveat here that jumped out at me in the research. And we need to be clear about this. This biological CTRL-Z button is exceptionally specific, is it?
Incredibly specific.
Yay.
The enzyme only works on hyaluronic acid-based fillers.
Only HA.
Only HA. So that includes your common facial brands like Juvederm or Restylane, and a specific one designed for intimate areas called Deserial Plus.
Meaning if you opt for a different category of filler, like the biostimulatory or permanent ones the sources mention, such as Radiesse, Sculptra, or liquid silicone, you are entirely out of luck.
Completely out of luck. Those products rely on entirely different materials, like calcium hydroxylapatite or polylactic acid.
Right.
So the hyaluronidase enzyme just doesn't recognize those molecular structures at all. If you get a permanent filler or even a semi-permanent biostimulator, the undo button literally does not exist.
That raises a huge red flag for anyone considering those alternatives. I mean, you really have to be sure.
You do.
But sticking with the HA fillers, I actually have a theoretical concern here. If I picture this enzyme as like a rogue Pac-Man going around gobbling up the hyaluronic acid dots in the skin.
Okay, I like that analogy.
Right. But you just established that my body naturally produces its own native HA. So is this rogue Pac-Man eating my natural tissue too?
It is, yeah. And that's a highly perceptive deduction. The enzyme is not selective.
Oh, no.
It doesn't have the capacity to differentiate between the synthetic cross-linked HA in the filler and the native uncross-linked HA in your own extracellular matrix.
That sounds disastrous. Like you go in to dissolve a lumpy lip and the enzyme just obliterates your natural structural support along with it.
Well, it will dissolve the filler, and it will concurrently break down the native HA in that localized area. So because of this, patients very frequently experience what looks like sudden volume loss.
Like they just look deflated.
Yeah, the treated area might look deflated, wrinkly, or even hollowed out. Often it looks thinner than it did before you ever had the filler injected in the first place.
Oh, wow.
It can be incredibly alarming for a patient to look in the mirror and see what appears to be rapid localized aging.
I would panic. I'd imagine that requires a lot of hand-holding from the clinician. But the sources note this hollowing isn't permanent, right? Like, how fast can the body realistically repair that kind of structural deficit?
This is where human biology is truly resilient. Your native hyaluronic acid has an incredibly rapid turnover rate. I mean, a 70-kilogram person has roughly 15 grams of HA in their entire body.
Okay.
And the biological factory is so efficient that about 1/3 of that total is degraded and newly synthesized every single day. The natural half-life of native HA in your skin is only about 24 to 48 hours.
Oh, wow. So your body is basically synthesizing new HA constantly. The hollowing is just a temporary drought while the localized factory catches up to the sudden enzyme attack.
Exactly.
Yeah.
While the enzyme does deplete your natural stores, creating that temporary deflation, your fibroblasts, the cells responsible for producing structural proteins and sugars, they're already working overtime.
That is so cool.
Yeah, the body naturally replenishes its own localized HA within about 2 to 4 weeks.
Okay, knowing that the natural tissue bounces back certainly makes the concept of dissolving way less terrifying.
Definitely.
Now that the mechanics of the erasure are clear, let's look at the canvas itself. We need to explore how this applies to labial puffing because, well, the vulnerability of our native HA is exactly what creates the demand for this procedure in the first place.
Right. And the clinical term for it is labia majora augmentation.
Right.
And you really hit the nail on the head regarding native tissue vulnerability. You hear so much about facial aging, the loss of collagen, the decrease in elastin, the thinning of the skin.
Sure, constantly.
But what you might not realize is that this precise biological degradation happens everywhere on the body, including the genital area.
Right. The sources point out that as estrogen levels drop, whether that's from natural aging, post-childbirth, or menopause, the fibroblast activity in the genital region decreases.
It slows way down.
Yeah. So the skin of the outer labia, the labia majora, naturally loses its youthful volume. It just becomes loose or deflated.
And it is a completely normal physiological evolution.
Totally normal.
But for some, that loss of volume causes physical discomfort, like chafing during exercise, for example, or it can cause significant aesthetic self-consciousness. Historically, the primary option was surgical intervention, like a labiaplasty, to actually remove excess skin.
Which is an intense, permanent surgical commitment.
Very much so.
So enter the labial filler. This is described as a minimally invasive 20 to 30-minute outpatient procedure.
Yes. So a medical practitioner utilizes premium pharmaceutical-grade HA fillers specifically formulated for the biomechanics of intimate tissue, things like Deserial Plus or Novia Rose.
Okay.
After applying a topical numbing agent, they precisely inject this cross-linked HA gel deep into the tissue of the outer labia.
Now, I want to dig into the physics of how this actually plumps the tissue. Is it purely just the physical volume of the gel taking up space under the skin, like stuffing a pillow?
Well, the physical presence of the gel does provide some immediate structural lift. But the true mechanism of action comes down to the hydrophilic nature of hyaluronic acid.
Hydrophilic.
Yeah, hydrophilic literally means water-loving. The HA molecule has a strong negative charge. These negative charges repel each other, causing the molecule to uncoil and stretch out.
Oh,
And that creates massive space to trap water molecules.
so it's essentially acting like a microscopic sponge implanted right in the tissue.
A sponge with staggering capacity. Hyaluronic acid can hold up to 1,000 times its own weight in water.
1,000, that's insane.
It is. Once injected, the filler draws fluid from the surrounding tissues via osmotic pressure. It hydrates the area from the inside out, swelling up to restore firmness and effectively expanding to fill out the loose skin.
And because these specific fillers are highly cross-linked to withstand the friction and movement of the genital area, the sources say this plumping effect lasts anywhere from 12 to 18 months before the body manages to metabolize it.
That is the standard timeline, yes.
Which brings us back to the central focus of this deep dive. You have a highly sensitive, intimate area of the body. You've just injected a water-drawing gel into it.
Right.
What happens if the aesthetic result is asymmetrical? Or what if it draws too much water and swells uncomfortably? Can these labial fillers actually be safely dissolved?
The definitive answer is yes.
Okay, good.
Because these premium intimate fillers are composed of hyaluronic acid, they are entirely reversible. If you experience an adverse reaction, uncomfortable swelling, or honestly, if you simply regret the aesthetic alteration, a qualified medical professional can inject hyaluronidase directly into the delicate labial tissue.
And it triggers the exact same depolymerization process we discussed earlier. The molecular scissors just go in and chop up the crosslinks?
The mechanism is identical, regardless of the anatomical location. The enzyme rapidly cleaves the bonds, and the unwanted volume in the labia can be significantly reduced or completely eliminated within a matter of days. What's fascinating here is that the guaranteed availability of this reversal treatment is exactly why AJ fillers are considered a low-risk option for intimate enhancements.
That makes total sense.
The chemistry itself provides a built-in escape hatch.
That creates such a profound psychological shift. You can alter a highly intimate part of your anatomy, knowing that if it doesn't suit you, the modification can just be erased.
Very reassuring.
But knowing it can be dissolved theoretically is one thing. The practical reality of the clinic protocol is a whole different beast.
Oh, it is a rigorous medical protocol.
Yeah.
The very first step, and arguably the most critical, has nothing to do with the filler itself. It's the patch test.
Oh my gosh, I was absolutely floored by the research on this. So I understand hyaluronidase is a prescription medicine, often derived from animal sources like bovine or ovine tissue, though I guess synthetic versions are becoming more common now.
Yes, exactly.
But the allergy risk associated with it is wild.
Because of its complex protein structure, injecting hyaluronidase carries a documented risk of allergic reaction. And we aren't just talking about a mild, localized rash here.
Right.
There is a real potential for full-blown anaphylaxis, which is a systemic, life-threatening immune response.
And the most surprising detail from the sources. If you are allergic to bee or wasp stings, your risk of going into anaphylaxis from this filler-dissolving enzyme skyrockets.
It does.
Like, why on earth is there a cross-reactivity between a cosmetic eraser and a wasp sting?
It comes down to the evolutionary design of venom. Bee and wasp venom, specifically from the order Hymenoptera, actually contain their own natural forms of hyaluronidase.
Wait, really?
Yeah, it's known as hyaluronidase 1. When a wasp stings you, it uses that enzyme to rapidly break down your extracellular matrix. It essentially melts the mortar in your tissue so the toxic components of the venom can spread faster and deeper into your bloodstream.
That is terrifyingly efficient biology.
It really is. So if you've been stung in the past and developed an allergy, your immune system has manufactured specific IgE antibodies primed to attack that enzyme.
Oh, I see where this is going.
Right, because the molecular structure of the cosmetic hyaluronidase is so similar to the venom hyaluronidase, your immune system might mistakenly identify the cosmetic injection as a massive wasp attack.
Meaning if you've ever needed an EpiPen for a sting, you absolutely must declare that to your clinician.
Without fail, you have to. This severe risk profile is exactly why clinical standards, like the ACE group guidelines, mandate an intradermal patch test for any non-emergency dissolving procedure.
Okay, so what does that look like?
They inject a microscopic, highly diluted amount of the enzyme just under the surface of the skin on your forearm. Then you basically sit in the clinic for 20 to 30 minutes under observation to see if a hive, wheal, or systemic reaction develops.
Okay, assuming your forearm stays clear and you actually pass the patch test, let's walk through the actual dissolving injection. So the practitioner has this enzyme in a powdered vial.
Correct. The lyophilized powder must be reconstituted. Practitioners typically use bacteriostatic normal saline for this.
And I'm assuming the bacteriostatic part is to maintain sterility, but the sources mention it contains a tiny amount of benzyl alcohol.
Yes, the benzyl alcohol acts as a preservative, but it has a secondary, highly beneficial clinical effect. It acts as a mild local anesthetic.
Oh, nice.
Yeah, it subtly numbs the tissue as the fluid enters, making the actual dissolving injection slightly less painful for you.
A very welcome bonus for such a sensitive area.
Definitely.
So after reconstitution, they inject it into the pockets of unwanted filler. But the clinical training sources highlight a specific physical manipulation that happens next. A warm compress for 3 minutes, followed by a firm massage.
Yes.
I'm assuming the warm compress is just basic physics, right? Heat causes vasodilation, expanding the local blood vessels so the enzyme can spread more efficiently.
You are spot on. The heat dilates the capillary network and increases local blood flow, which optimizes the environment for enzymatic activity. But the massage that follows is arguably even more critical.
Why is the massage so important? If the enzyme is just molecular scissors, shouldn't it just, cut whatever it touches?
It does, but you have to remember the limitations of the drug itself. The half-life of injected hyaluronidase is incredibly short,
Ow, sure.
only about 2 to 3 minutes before it degrades.
Wait, if the enzyme only lives for 2 minutes, how on earth does it manage to clear out an entire millimeter-thick deposit of dense cross-linked filler gel?
That is precisely why the firm 2-minute massage is mandated in the protocol. The practitioner must mechanically force the enzyme through the dense tissue, ensuring it physically coats and permeates the entire bolus of filler gel before the enzyme degrades.
Oh, wow.
Yeah, the mechanical shear stress of the massage, combined with the enzymatic cleaving, is what rapidly breaks down the structural integrity of the HA.
Here's where it gets really interesting. The timeline of the visible results.
Right.
Because even with a 2-minute half-life, the depolymerization starts almost instantly upon contact. You can literally see visible softening within an hour. But the sources are absolutely adamant that you cannot judge the final result on day 1 or day 2.
And that is a huge psychological hurdle for many patients. You have to remember, you'll have localized trauma from the needle, fluid expansion from the saline, potential bruising, and the body's inflammatory response to the sudden influx of simple sugars in the lymphatic system.
Right, it's a lot of trauma.
It might look worse on day 2 than you did on day 0.
So if you wake up and your labia or your lips look aggressively deflated, uneven, or just bizarre, you have to write it out.
You must write it out. It takes a full 14 days for the inflammation to completely resolve, for the lymphatic system to clear the debris, and for your body's native factory to begin replenishing the native HA that was collateral damage.
That's a solid 2 weeks.
Yes. And furthermore, you absolutely cannot have new filler injected into that tissue before the 14-day mark. If residual enzyme activity is still present, it will simply dissolve the new expensive filler you just paid for.
That makes complete sense. You need a clean, stable canvas before you try to paint again.
Exactly.
Now, up to this point, we've explored this entirely through the lens of an elective procedure. You don't like the aesthetic results, so you ask for a redo. But the clinical literature heavily emphasizes that hyaluronidase isn't just a cosmetic luxury.
It is not a luxury. In certain scenarios, it is quite literally a rescue drug.
Let's pivot to the dark side of dermal fillers. What happens when this biological eraser transitions from an aesthetic choice to an absolute medical emergency?
The most severe, catastrophic complication associated with any dermal filler injection is a vascular occlusion.
A blocked artery. Because the anatomy of the human face and the genital region is this highly complex, interconnected web of blood vessels and arteries.
Right.
When a practitioner is injecting a thick gel into that tissue, they are essentially navigating that vascular web blind, aren't they?
Precisely. And if the tip of the needle inadvertently pierces an artery and deposits the filler inside, or even if too much filler is injected into a tight space and the external pressure collapses an artery, the blood flow is instantly halted.
It's not just a cork in a bottle. It's more like damming a river. The tissue downstream isn't just dry, it's actively starving for oxygen and nutrients.
That is the exact physiological reality. When the tissue is starved of oxygen, a state called ischemia, it begins to die. This is known as tissue necrosis.
Horrifying.
If a vascular occlusion occurs in the labia, you risk severe ulceration and permanent tissue loss.
Then on the face.
If it occurs in the face, particularly around the nose or the glabella between the eyebrows, the pressure can force the filler to travel backward through the arterial anastomosis.
Connecting blood vessels.
Right, it travels backward.
Traveling backward toward the eyes.
Yes. The filler can enter the central retinal artery, blocking blood flow to the eye. This results in instantaneous, irreversible blindness.
Oh my God.
It is a statistically rare event, but it is a fully documented catastrophic risk of dermal fillers.
This is where I really want to highlight a massive safety reality for you listening. In jurisdictions like the UK, hyaluronidase is legally categorized as a POM, a prescription-only medicine.
That is a critical legal and safety distinction.
It means that only a qualified medical prescriber, so a doctor, a dentist, or an independent prescribing nurse, can legally access, stock, and administer this drug. If you go to a local salon or a non-medical beautician to get your lips or your labia filled, they might be incredibly talented at aesthetics, but legally, they cannot prescribe or hold hyaluronidase.
Which means if a vascular occlusion happens in their chair, you are in immediate, severe danger.
Because if that river gets dammed, you have a very short window, sometimes just hours, to flood the surrounding tissue with massive, repeated doses of hyaluronidase to melt the blockage and restore blood flow. You do not have time to call an ambulance and wait in a crowded emergency room.
You really don't.
If your injector does not have this drug in their immediate possession, you risk permanent disfigurement or blindness.
If we connect this to the bigger picture, it highlights a stark and worrying divide in the aesthetics industry. The British Association of Aesthetic Plastic Surgeons, or APS, recently issued a formal statement regarding the use of this enzyme.
Oh, what did they say?
They noted that while vascular emergencies absolutely require immediate high-dose dissolution, there is an alarming trend of patients demanding emergency dissolution simply because they are anxious about minor swelling or an imperfect cosmetic result.
The instant gratification mindset. They see a bit of asymmetry on day 2 and demand the practitioner hit the undo button immediately.
Yes. And Bobies is forcefully stressing that a measured, careful approach is vital. If it's purely an aesthetic issue, you must wait for the initial filler swelling to subside. Do not rush into dissolving, because as we've thoroughly explored, introducing hyaluronidase carries the risk of anaphylaxis and the temporary destruction of your native structural tissue.
Right, it's not a toy.
It is a powerful, blunt force medical intervention, not a casual cosmetic eraser.
Okay, let's zoom out and look at the landscape of what we've covered today. We started deep in the extracellular matrix, exploring how hyaluronidase acts as molecular scissors to depolymerize synthetic hyaluronic acid.
We examined how that specific biochemistry enables the growing trend of labial puffing, offering a reversible hydrophilic solution for intimate volume loss.
We navigated the strict clinical realities of the procedure, the mandatory patch testing, the surprising evolutionary link to wasp venom, and the mechanical necessity of heat and massage to maximize the enzyme's very short 2-minute lifespan.
And we concluded with the stark medical reality that this enzyme is a prescription-only rescue drug that really stands as the final barrier between a cosmetic complication and a devastating necrotic emergency.
So what does this all mean for you? Beyond the intricate biochemistry and the strict clinical guidelines, there is a fascinating psychological layer to this entire discussion. We are currently living in an era where you can fundamentally alter your face or your most intimate anatomy in a 30-minute appointment, knowing full well you have the power to simply erase the modification by the weekend if you dislike the reflection in the mirror.
The science has successfully engineered a biological safety net, and this raises an important question about human behavior.
Exactly. When the consequences of physical alteration are removed from the equation, when the permanence is just stripped away, how does that change your personal calculus of risk?
It's a huge shift.
If you know an undo button exists, does it make you more daring, more experimental, or perhaps more cavalier in how you choose to modify your own body? It's a fascinating shift in how we perceive the permanence of our own physical identity, something to ponder the next time you find yourself wishing for a CTRLZ in your own life. Thank you for joining us on this deep dive. Keep questioning, keep learning, and we'll see you next time.